Know which media houses are here. We want to know which personalities are here. So we start from right.
Good morning. My name is Samira Ghana News Agency. I'm Selma, the finder. This is what you need.
Man was a Samari for my case.
Focus upon rankings, many times.
How the general results. Benjamin Janet. Not really well, but I was my name is Nana Poku Fred. Ghana is good. So with this, we know who is here. And again, you have the honor of having Director General of the Ghana is Dr. Discriminatory. We have Kenton Mbonde, who is the country coordinator for the UN AIDS. A few people online. They'll be introduced as the program goes on. Thank you very much. So without much ado, we want to ask Director General of the Ghana Dr. Discriminatory, because the statement of Zero Discrimination. Thank you.
Thank you very much, Dr. Nana Poku. Madam Angela Trenton Bonde, UNA's Country Director. Dr. Tony Au, Country Director of Centers for Disease Control and Prevention, and also the Country Coordinator for PEPFAR. Madam Elsie Aye, the President of National Association of Network of Persons Living with HIV. Our partners and stakeholders watching us online, members of the press, distinguished ladies and gentlemen, good morning. I welcome and thank the press for responding to our invitation to this brief interaction session. Today is Zero Discrimination Day. The Zero Discrimination Day, which is observed on 1st March every year, was instituted by the UNAs in 2014 to promote equality and fairness before the law. The day is celebrated to create awareness and fight the systemic and cultural discrimination against persons living with HIV. We are gathered here this morning in solidarity with persons living with HIV and affected by HIV to make Ghanaians understand that zero discrimination is about the fact that HIV infection does not make a person less of a human being. HIV stigma and discrimination is unimaginably pervasive in the country. According to the Demographic and Health Survey of 2014, conducted by the Ghana Statistical Service, as high as 92% of women and 85% of men expressed unacceptable attitudes towards persons living with HIV. Results of this survey clearly demonstrate that ignorance and misconceptions about HIV drive such unacceptable levels of stigma and discrimination against persons living with HIV. Several studies conducted in Ghana on HIV-related stigma and discrimination show that the experience of stigma and discrimination is a daily occurrence in homes, schools, churches, workplaces, and in many communities across the country. These findings have been confirmed by data from the discrimination reporting system of the Commission on Human Rights and Administrative Justice, SHRAJ for short, which show that persons infected, affected, or at risk of HIV continue to suffer various forms of discrimination, some of which include eviction from rented or family houses, denial of employment, where employers may refuse to employ or engage someone who lives with HIV, or dismiss the person living with HIV from the job, or discriminate in terms of promotion and other benefits associated with the employment. Denial of share of property, especially among family members, whether in relation to inheritance or marriage. Denial of maintenance of children, denial of education of children of persons living with HIV or children whose parents died of HIV, who have been made orphans. Denial of police assistance, especially when people living with HIV suffer any discrimination, and when they report to the police, some of them sometimes deny them assistance. Denial of health service, disclosure of HIV seropositive status to a third party, divorce or desertion by a spouse, non-payment of wages on grounds that somebody has HIV, and by refusing to pay the person for the work that she or he has done and the wages she deserves, all with the intention to drive away such a person from the job. Violence and physical abuse, blackmail, sexual harassment, or assault. These and many others are the lived experiences of persons living with HIV in Ghana. Ghana AIDS Commission also frequently receives similar reports and complaints from persons infected or affected by HIV. Sometimes persons living with HIV are prevented from using the same toilet, bathroom, or kitchen used by landlord or co-tenants. All these unacceptable situations actually places the person living with HIV in a very bad condition, including mental health conditions. We are therefore using this event to tell Ghanaians that these practices are in complete violation of people who are made to unjustifiably suffer these atrocities. Distinguished ladies and gentlemen, the theme for this year's Zero Discrimination Day is remove laws that harm and create laws that empower. In line with this theme, we want to use this occasion to enlighten persons living with HIV and the general public about the Ghana AIDS Commissions Act. That is Act 938. This act applies the human rights provisions in the Constitution to HIV for easy interpretation and delivery of justice. Thus, the Act 938 empowers persons infected, affected, and or at higher risk of HIV to assert their constitutionally guaranteed rights. Under the non-discrimination provisions of the Act, a person infected or affected or at higher risk of HIV shall enjoy the fundamental human rights and freedoms enshrined in the Constitution. This means a person must not be discriminated against because of his or her HIV seropositive status. 2, a person who suffers discrimination of any form because of his or her HIV seropositive status can assert his or her rights through legal proceedings. 3, a person infected or affected or at higher risk of HIV shall enjoy the right to health. A person infected or affected or at higher risk of HIV shall enjoy the right to privacy and confidentiality. This means that his or her HIV positive status cannot be disclosed to a third party except under certain conditions outlined in the Act. One is where that information is required by clinicians for appropriate decisions relating to the care and treatment of that person, or it is required by the law courts. Apart from these, there is no other grounds on which anyone's HIV positive status can be disclosed to a third party. 5, a person infected or affected or at higher risk of HIV shall enjoy the right to work. And a person, number 6, shall also enjoy the right to insurance of all kinds, health insurance, life insurance, group insurance, any form of insurance, they have the right to enjoy these. 7, a person infected or affected or at higher risk of HIV shall enjoy the right to education. And sadly, I would like to mention that a number of children whose parents live with HIV or perceived to live with HIV have suffered this kind of discrimination, and that should discontinue. 8, a person infected or affected or at higher risk of HIV shall enjoy political rights. Persons living with HIV can also enjoy freedom of movement, and they can also enjoy sexual and reproductive health rights. And lastly, a person living with HIV or affected by HIV shall not be discriminated against on any grounds based on these provisions in the Act. Any person who stigmatizes or discriminates against PLHIV or those affected by HIV causes an offense punishable by law. And we wish to encourage persons living with HIV or affected by HIV in any way to recognize that these rights are guaranteed by law, and therefore they must assert these rights by reporting such cases to the police or to SHRAJ or go to court for legal redress. Ladies and gentlemen, having said this, I would like to point out that stigma and discrimination significantly undermine the National HIV and AIDS program. It drives people underground and prevents them from accessing the life-saving treatment services that have been made available throughout the country. People living with HIV tell me that stigma is what kills them and not AIDS. And from what we have seen in scientific literature and the lived experiences of persons living with HIV, it is 100% true that stigma kills more than the disease itself. And therefore, we all have to work together to eliminate stigma and discrimination associated with HIV in this country. Everyone has a part to play. The media has a part to play. The religious bodies also have parts to play. Schools, employers, and community leaders all have a part to play. We all have to work together and decide and commit to ensuring that no one in this country affected by HIV in one way or the other must suffer any form of discrimination or stigma. I thank you for your attention.
Thank you very much. And we are grateful to the Director General of the Ghana AIDS Commission for teaching us this statement, Zero Discrimination Day. Indeed, we all have to place in reducing or breaking down stigma. Once again, on our program, we have the country director of UNA also giving us a statement on this very special occasion of Zero Discrimination. Madam Angela, you have the floor.
Thank you very much. Dr. Chirwin Atwini, Director General, Ghana AIDS Commission. Dr. Tony Oye, Country Director, Centers of Disease Control, Ghana. Ms. Heather Robinson, HIV Team Lead, PEPFAR Coordinator, USAID. Other development partners, Ms. LCIA, President of the National Association of Persons Living with HIV. Media partners, distinguished ladies and gentlemen, and all the colleagues online. Good morning to all of you and greetings on this Zero Discrimination Day. The United Nations has set aside today, 1st of March, as Zero Discrimination Day. We turn the spotlight on one of the biggest challenges we face by our societies today. This is discrimination. It is a day for us to think about the meaning of discrimination and how discrimination affects the lives of people experiencing it. Discrimination refers to the selective practice of unfairly others, and this could be based on several factors, including religion, race, gender, age, disability. It is a day when each of us can reflect on whether we are fully aware of our actions and whether we are discriminating in any way and whether we are respecting the human rights of everyone. We can also ask the question, what do I do when I witness discrimination? Should I speak up or should I remain quiet? According to John Lewis, civil rights leader and politician of the United States of America, and I quote, "When you see something that is not right, not fair, not just, you have to speak up. You have to say something. You have to do something," unquote. This year's theme, remove laws that harm, create laws that empower, highlights an urgent need to take action against discriminatory laws. One may ask the question, what are discriminatory laws? In simple terms, discriminatory laws are laws that deny human rights and fundamental freedoms. Laws must protect, not harm. Studies have proven that discrimination against key populations block access to HIV services and impact the quality of care of people living with HIV. As a matter of fact, discrimination kills, and we heard the Director General of GHC explaining this. So discrimination remains one of the biggest battlefields in the world, and Ghana is no exception. Distinguished ladies and gentlemen, viruses like HIV, COVID-19, do not differentiate between people, but societies do. People stigmatize and discriminate against people living with HIV, mostly out of ignorance, because they're afraid of HIV. However, let me reiterate, as the DG did, that HIV is not a death sentence. The antiretroviral medicines that are available today save lives when they are taken continuously. And we should also note that viral suppression in the body resulting from the adherence to antiretroviral treatment presents the transmittal of the virus from one person to another. To end AIDS by 2030 and to achieve the Sustainable Development Goals, we must confront discrimination. Tackling inequalities and ending discrimination is indeed crucial to ending AIDS. I urge all of us to not discriminate and to also fight against discrimination and stigmatization. Ending discrimination and changing laws is the responsibility of all of us. Everyone can play a part in ending discrimination and can try to make a difference in ways both big and small. Thank you very much for your attention.
We thank the UNAIDS country director for that insightful message. We have to remove laws that harm and create laws that empower. On this note, we want to invite the chair who is being represented by
Good afternoon. Good morning, actually. Can you hear me, please?
Yes, we can hear you. You have to talk.
We can't hear.
GAC Director General Dr. Jeremy Atulane, NAPLA's President Ms. Elsie Ayer, members of the media, distinguished ladies and gentlemen, good morning. On behalf of the U.S. Embassy and the President's Emergency Plan for AIDS Relief, also known as PEPFAR, thank you for this opportunity to add our voice in solidarity and support of Zero Day. This year's theme, remove laws that harm, create laws that empower, is especially poignant and relevant. PEPFAR has been in Ghana for 14 years. In total, the US government has invested over $140 million to help the people of Ghana slow the spread of HIV while supporting families and people living with HIV with life-saving medications, as well as investing in crucial health systems that are required for HIV epidemic control. Much of PEPFAR's work is focused on person-centered approaches to stop the spread of HIV and to ensure those living with HIV are virally suppressed. This subsequently improves the health and the lives of people, families, and communities, as well as prevents further spread of HIV to others. Our work includes supporting community service organizations, health facilities, district and regional health directorates, and the National HIV Response Leadership. In addition to the government of Ghana, we also work hand in hand with the Global Fund, UNAIDS, and WHO in a collaborative and integrated approach. We are all in this together. Supporting people living with HIV and those who need HIV prevention services require addressing stigma and discrimination head on. To discriminate against a person because of who they are or their health status is to deny them of their immutable rights to live in a more dignified life and prevent them from attaining their full potential. In the context of HIV, discrimination and stigma come in many forms and at many levels, sometimes obvious and oftentimes insidious. It could mean preventing people living with HIV from getting appropriate treatment, thereby denying them of good health and enabling further spread of the virus. Or it could mean making it very difficult for groups of people to access much needed HIV prevention services to protect themselves. And lastly, it also means perpetuating harmful beliefs and practices that are barriers to being inclusive and therefore failing to adopt a human rights approach to healthcare and policies. Ending discrimination and stigma today means saving lives tomorrow. As we seek to reach epidemic control, finding 95% of those who have HIV, getting 95% of those on treatment, and then ensuring 95% of those on treatment are virally suppressed, these are UNAIDS 95-95-95 goals, and PEPFAR stands firmly in support of them. We won't get there by ignoring people at greatest risk of infection, by stigmatizing people living with HIV, or by allowing harmful discriminatory practices to continue at all levels of the health system and in society in general. Worldwide, PEPFAR has saved more than 20 million lives since 2003. This progress can easily be undone if we stigmatize and discriminate against people living with HIV and other marginalized groups. Policies that drive people to conceal their status, hide their sexual orientation, and avoid testing and treatment can undo this hard-earned progress. Stigma and discrimination can therefore cost lives. So today, as we commemorate Discrimination Day, we call on every Ghanaian to make their voices heard. And as the country director of UNA said, think about what you are doing in your own personal life. We hope that leaders, communities, and members of the media will help ensure that people living with HIV and other vulnerable groups are embraced and not ostracized. That is how we defeat stigma and discrimination as a community and as a nation. At PEPFAR, we operate under 3 pillars of impact, accountability, and transparency. This year and going forward, we are adding a 4th pillar that is of equity, which is to demonstrate effective efforts to tailor services, close gaps, and address barriers that are faced by people most vulnerable to HIV. Therefore, PEPFAR's pledge on Zero Discrimination Day and on every day is to stand with the government of Ghana, our multilateral partners, community organizations, and most importantly, the people that we serve in solidarity as we work towards confronting discrimination and ending HIV stigma for all. Thank you for your kind attention.
Hello? Please, can you hear me?
Yes, I can hear you loud and clear. Can you hear me?
Yes, we can. Please, you have the floor.
Okay. Thank you very much. The Director General of Ghana AIDS Commission, Country Director of UNAIDS, Country Director of CDC, HIV Team Lead of USAID, Heather Robinson, partners, stakeholders, NAPLAS members, participants online, the press, ladies and gentlemen. It is a great pleasure for me to participate in this session celebrating the Zero Discrimination Day. It is very apt and it is in line with enabling persons living with HIV to be able to live quality lives, lives that are their right to have without discrimination. I would like to acknowledge the contribution and support from UNAIDS, from Ghana AIDS Commission, and all other partners towards ensuring that our community have and live quality lives. Ghana AIDS Commission and the 2020 regulations LI 2403 595 target, and PEPFAR's use of person-centered approaches, which they have experienced great successes with, are all acknowledged as ways in which persons living with HIV are being supported to live quality lives. We know that laws exist, laws against discrimination exist, and the main thing they do from our point of view is to provide the conducive environment for persons living with HIV and affected by HIV to live full, successful, stress-free, quality lives. It enables us, the aim also enables us to have feelings of self-worth and self-esteem. We have seen, we know that there are those laws. We know what they are supposed to do, but in reality, what actually is the case? I'm glad that this celebration, 1st of March, has given us the opportunity to talk about discrimination, to celebrate the fact that there's something being done to ensure we live quality lives. What those laws work? We see that and we know that discrimination leads to people losing their self-worth and self-esteem on the individual's person. And if, with all those things, discriminatory things that
it is now time for some reflections and some comments and questions from all of us gathered here. Anyone who has a comment, a question, wants any clarifications on any of the points that have been raised this morning, kindly show by your hands so that you're acknowledged to make your presentation. Thank you. Oh, thank you. I think Madam Elsie is back. Madam Elsie, please, can you hear me?
Yes, I can hear you.
Sorry we lost you, but welcome back.
Thank you.
We can proceed.
So can I continue where I left off? Or?
Yes, madam.
Okay. I was saying that discrimination can lead to people losing their self-worth or self-esteem. because it touches on an individual's person. The person's age, disability, gender, as the UNAIDS country director had said. And if we add being HIV positive to all these other things that make people discriminate others, then we can all imagine its effects. It's a very painful and shattering experience. So we want to ask, do the laws actually work? Should we have faith in these laws? Because there are many barriers between enacting laws and seeing results. There's usually a long wait between enactment and implementation. There's a difference between knowing what these laws are and having the confidence to take anyone on who discriminates against persons living with HIV. Do these laws change attitudes, social and traditional beliefs, or they remain the same? These are issues that we need to look at. GAC has the acts and the legislative instruments, UNAIDS, the 1995 targets, and PEPFAR is using person-centered approaches with great success. How can we leverage on these? How can we push? How can we move forward to ensure that persons living with HIV in all our diversity are free from discrimination? I'll just end on this note. Thank you very much. Over.
Thank you very much, Madam President. And one of the issues she has raised is, do these laws work? Or are they even tried? On this note, it's time for questions, comments, and issues that any one of us wants to raise, both online and present in this room. Are there questions or comments, please? Maybe I want to write my own script and mark, as someone would say. So I want to ask a question or make a comment. DG, Madam Elsie was asking about whether these laws work. I don't know if you have any comments on that. Probably it's not interested. Thank you very much.
Thank you very much for that question. Indeed, the laws work when they are applied. A number of cases are reported in the regions to the regions and districts at the Office of SHRAJ, sometimes to the police, and sometimes to the Ghana AIDS Commission regional offices. These cases are often pursued to their logical conclusion. But the challenge is that in many of such cases, persons living with HIV because of discrimination wouldn't want to pursue the case because they think that when it gets to court, they will be in the open court to argue their case out. It's because of the ignorance of the law. Now, the Ghana AIDS Commissions Act specifically requires that such cases should be held in camera so that the persons involved, especially those living with HIV or affected by HIV who have suffered discrimination, will have the privacy and ensure that their HIV status is not made known to the public through the court proceedings. And the Act also requires that all such cases or the proceedings of court should also be kept in confidence by the court. Again, to ensure that the HIV status of these persons is not made public. And so the law works. It is up to our stakeholders, especially persons living with HIV, to have confidence in the justice system and to have confidence in the law and confidence in themselves that if they assert their rights legally, they will have justice. And I want to use the example of a case, a ruling that was given in one of the Sunyani High Courts in June last year. It involved a woman who lives with HIV. Apparently, she is a widow and trying to make a living by selling food to take care of herself and her children. And someone who got to know her HIV status would tell buyers not to buy from that woman because she lived with HIV. And the woman had, lived with this for a long time and was afraid to take up the matter. But the network of people living with HIV in the region took the matter up, and it eventually ended up in court. And the case came to its logical conclusion, and the woman, the gentleman who did that was actually punished by the court, and the woman was compensated. And so this tells us that it works. And I also want to use the opportunity to inform our persons living with HIV that apart from SHRAJ and the commission, if you think that your case may involve costs and therefore you cannot afford the cost associated with the court case, just inform SHRAJ or Ghana AIDS Commission Office or even the District Assembly HIV focal person. They will arrange for you to have a lawyer from the Legal Aid Commission to support you and push through your case at no cost to you. And so the laws work, and we have the system that actually ensure that the law should work. I thank you.
Thank you very much. So the UCD also has some comments on this matter.
Continue on this issue about laws and the value of the laws. Laws help to keep people accountable. There must be a system of redress when there's violation. But the laws are not enough. We need additional support. People should know their rights, and many times they do not know their rights. So we need to have programs that inform people of their rights and have platforms where people can discuss the real challenges that they are experiencing on the ground. But their voices must be heard. And there should be a feedback system to a health facility, for example, if there's a violation. And that is why in the UN system, in collaboration with UNDP, so UNAIDS and UNDP are looking at establishing zero discrimination health centers, supporting health centers to be a zone that we can call discrimination stigma free. And in such a mechanism, we might have a feedback system where the clients, where people living with HIV can give feedback anonymously on any kind of stigma and discrimination they're experiencing. Another way to incentivize this is to have an award for centers that are showing that they are stigma-free and discrimination-free. So creates a kind of healthy competition that actually promotes that desire to be that kind of zero discrimination free center. I also mentioned earlier that it's our responsibility to speak up when we see something. So when we see someone being discriminated against, that we speak up and we become sort of our neighbor's keeper. Our neighbor is anyone we come into contact with. Thank you.
Thank you very much. Yes, there is a representative online, Mr. Gideon. He has a question. Please go ahead and can we hear you? Mr. Gideon, please.
Good morning, everybody.
Good morning.
My name is Gideon Ajaka from Alliance for Equality and Diversity. Thank you very much for this opportunity to celebrate Zero Discrimination Day today. I have some few questions that I would like to ask Ghana Youth Commission. And then here are my questions. So currently, we know that there is a bill in Parliament that seeks to actually criminalize marginalized communities, specifically LGBTIQ people. We cannot talk about zero discrimination, HIV, and AIDS without talking about subsets of this group, specifically MSMs and transgender persons. And we all know that for the past few months, the extensive discussions and conversations around the bill does not only seek to criminalize these people, but even prevent healthcare workers from taking care of them, forcing healthcare workers to disclose their status, and even subjecting these people to treatment without their consent. How is Ghana Youth Commission ensuring that the Act 938 will have an influence in ensuring that this bill does not come into pass? Because once this bill comes into pass, it would actually increase stigma and discrimination from external persons towards people living with HIV who equally identify as MSMs, gays, bisexual men, and transgender persons. How are we also ensuring that we are communicating the impact of the criminalization of key people in clear language to proposers of the bill to ensure that our work that we have done over the years do not go back to the drain? If we want to continue talking about the 1995 goals and ensuring that people do not experience stigma, how are we using our positions to ensure that this bill does not come into pass or does not pass? Thank you.
Thank you, Mr. for your question. Right, Didi. And then you see. Any comments on the question?
Yes, thank you for that question. And we want to say that the right to health is for all people, including MSNs, including the whole of the LGBTQI community. It's a right, and laws that discriminate against this right is a violation of human rights. So what we have done, I think what Ghana AIDS Commission has done, what the UN has done, is just stated this position. As you know, that this matter is being heard before the Parliament, and the voices of people, the voices of institutions concerned are being heard. We have been able to present a position. And as we have said, you know, what does it do? How these laws drives people on the ground, and then they don't access the services that they need. They could die. It drives up the cost of healthcare. So it's really harmful. This is an example of showing how a law could be harmful. So, but what we need really is dialogue. It's really that understanding among all the people involved on the implications of what such a law would do. And we are engaging in this dialogue with various sides, and try to bring us together, see what is this that brings us together rather than divides us, and what is in the best interest of Ghana. And it's the people of Ghana who will decide this. For us in the UN system, we can bring our case, we can say that Ghana has signed on certain treaties, what is enshrined in the Declaration of Human Rights, what is in the Ghana Constitution, all that Ghana has signed on to, and then it's up to Ghana to re-examine that and really come to a decision that will not harm, that will protect the rights of everyone.
Thank you very much, UCB.
Yeah, thank you for that question, gentlemen. I think what we have seen since the proposed bill was brought to Parliament is that there is continuous engagement as to whether it should be passed or not passed. And so that engagement is what ECD calls dialogue, is happening across the country. And we believe that Ghanaians or Parliament that reserves the mandate to pass laws will consider all the presentations made to them, and in the best interest of Ghana and everyone living in this country, do the appropriate thing. And we have to recognize that Ghana is not alone in this respect. There are about 71 countries that have laws, you know, that have such laws. And I think it is something that many international organizations and countries are advocating, that these laws must be disempowering and therefore should be done away with. You want to know what we are doing to use the in using the Ghana AIDS Commissions Act to advance uninterrupted access to HIV services in the country. If you listen to the presentation I made earlier, the law is quite clear. The act is quite clear. It guarantees the rights of every person to have unfettered access to HIV and AIDS services in all health facilities in the country. And therefore, you should be rest assured that nothing will stand in the way of anyone who lives with HIV or affected by HIV in one way or the other from accessing the services from our health facilities. That one is guaranteed by the Constitution and by the Ghana AIDS Commissions Act. And as a commission, we will ensure that everyone receives the needed services that they require. Thank you very much.
Thank you, DG. Thank you, UCD. Are there any further questions? I see one hand there. Any more? Okay, so please go ahead. Thank you. Amplify your voice.
Sure. Okay. My name is George Wilson, and I work for Parliament. Quick one at the back of videos question we asked earlier, and the fact that somewhere last year we were told that most of the categories that came out as to the population of HIV positive from a certain group. I want to know on today's event and the year marking this Zero Discrimination Day and its team, what is the Commission doing to actually narrow in the custom and culture of Ghana into some of these laws that we are taking out and bring it so that it's different from other countries that are participating in this?
Let me repeat the question. Sorry,
It's not clear.
I want to be very clear. Please repeat your question.
So based on what we have asked earlier, and some facts that we told last year that some the highest population of positive AIDS patients actually coming from a certain group of people that I want to mention here. And the fact that today's event or this year's event under the team or on the team that they are taking some laws and bringing in some laws that do not harm any individual in that position. I want to know that what is the Commission doing so that who actually factor the custom and tradition of Ghana specifically as compared to other countries.
Thank you very much.
Struggling to understand the question, but I just want to say that so far as the anti-LGBT bill is concerned, which is presently before Parliament, we don't know whether it will be passed or it will not be passed. There are things I cannot say here, but I just want to say that so far as the laws of this country allow us to do our work, and I believe that the Ghana AIDS Commissions Act was passed by Parliament, the same Parliament which is now being asked to consider the LGBT Act. And in principle, you cannot pass an act that, you know, undo an existing law. You get the point. And so I think we all have to wait patiently and expect that the House of Parliament will use its good judgment in taking the best interest of the country so far as this bill is concerned. Yes, there are a number of cultural issues that actually encourage stigma and discrimination, especially disease-related stigma and discrimination. And we are working with various stakeholders in Ghana to address that. One of the things that we are going to do, we have been doing in the past, and we want to strengthen now, is to work with the traditional authorities, to address some of these harmful sociocultural practices, especially those related to inequalities, especially gender inequalities and things like that. So we are actually focusing on every aspect of our lives that undermine the efforts we are making and reversing the gains we have made so far in the national response. We have come too far to retreat. And so we are committed to ensuring the success of achieving the 95-95 targets and making HIV a non-public health threat in the country in this decade. Thank you.
Thank you, Gigi. Commitment to end AIDS by 2030 and remove all inequalities in Ghana, especially the area of HIV and AIDS.
Okay.
Thank you once more, Gigi. Are there any more questions, comments? I don't see any more hands.
Yes. So
on this note, we will be concluding on this section. We are so grateful for everyone who is present, the media, our representatives and partners, the FEPA group, the UNAIDS, the NAPLAS Association of Persons Living with HIV, the Ghana AIDS Commission, and all media partners as well. We are so grateful for your time. The next on our agenda is the closing remarks, and we humbly want to invite the Director General of the Ghana AIDS Commission to give us a brief closing remarks. Thank you very much.
thank you, Dr. Poku. Once again, on behalf of the Ghana AIDS Commission, the UNAIDS, and the PEPFAR friends, we want to thank the media for responding to our invitation. And we believe that the message that we have conveyed at this event will be carried out to the hearing of the public, because people have to know that discrimination of any form is very bad for the individual and our society as a whole. And we all have to work together in eliminating any form of discrimination in the country so that people can live dignified life and have a high quality of life in every sense of the word. And so we count on you to make the information we have given to reach the public. We also have other materials that we are, disseminating on social media. Please help to spread or to disseminate those materials as well, as much as you can. Thank you very much and enjoy the rest of the day.
Thank you very much, Gigi. Discrimination of any form is unacceptable in our society. Thank you, UCD. Thank you, Gigi. So there is a request for a group photograph. We will have a group photograph outside, and then we can discuss. Thank you.
From the Mr. and Robert side.